Welcome to Big Stone Therapy's video series. Today, we're diving into a common issue that affects millions of people, carpal tunnel syndrome, or CTS, you might hear it. If you ever experience numbness, tingling in your hands, or maybe even pain in both hands, um, this video might be for you. So we're going to talk about what it is as therapists, how we diagnose it, or things we look for, and then most importantly, how therapy can help. So let's get started. With me today is Nick Hendricks, Doctor of Physical Therapy here at Big Stone Therapies, our local hand expert. Talk to you a little bit about carpal tunnel. So, Nick, tell us a little bit about what it is.
No, sure thing. So, carpal tunnel syndrome, it's one of the main nerves coming out of your neck, going all the way down into your arm through your fingers. And it's these three fingers and a little bit of your ring finger here on the front side. It's when they get a little angry. And that's a lot of times because of compression within, they call it your carpal tunnel. There's small hand bones that kind of surround the nerve here. And if it does get compressed, that's when we start to see some numbness, some tingling. You might get a little bit of weakness through your hands. Maybe you're dropping things. And a lot of times it gets worse at night and it can make sleeping pretty tough. And yeah, it's not good.
Now, who commonly gets affected by carpal tunnel?
I Usually, we're talking about women and women that are middle-aged to older, and people that are working with their hands a lot. So if you're doing a lot of typing for hours and hours a day, if blue-collar workers like electricians or anybody that has to twist a screwdriver or do fine motor movements with the hands. Um, yeah, assembly line workers, musicians, stuff where you're using your hands quite a bit.
Yeah, and especially those new parents lifting babies all the time too can kind of those repetitive movements can really get you. So as a physical therapist, when somebody comes into the office and they say, "Yeah, my hands are hurting, they're burning, they're numb, they're tingling, I'm dropping things," what are the things you look for in an evaluation to determine is this carpal tunnel and is this something we can treat in therapy?
So we're gonna take like a combination of your medical history, the symptoms that you're having, and we're gonna run you through some special tests just to kind of see is this really carpal tunnel or is this something completely different? And some of these tests that we're gonna use, one's called the Phalen's test. You're gonna bring your hands together like this, and you're gonna hold it for 60 seconds. And if that reproduces any of the tingling or the pain, numbness, burning, that's going to be a positive sign. If we actually start tapping where the carpal tunnel is and that reproduces your symptoms, that's going to be a positive sign. We can press down on the carpal tunnel to see if that's going to, again, reproduce any of your symptoms. Um, Short tests like that, and we'll have to differentiate if any of it's coming from the neck because everything's connected and that's where the nerve starts. So we want to make sure, is it pretty local to the hand or is it something that we got to worry about going all the way up into the neck?
Yeah, I think that's so important, Nick, is to make sure it's more than if it is more than just the carpal tunnel, right? We do see that relatively common where the median nerve is maybe affected the whole length down. And sometimes when the carpal tunnel is irritated, the median nerve can be irritated, right? The whole length. Then sometimes when it's irritated at the neck, it can feel like it's at the wrist and hand. So it's very important that we're doing a nice full workup, making sure there's good nerve mobility through the arm, and then make sure the neck's moving well too. So I think that it's definitely one of those things we see in the clinic, and we can have a pretty good idea that we can treat it. And the good news is, a lot of people get better with it, right? Um, and in mild cases, a lot of times we can prevent surgery. Um, so, Nick, do you mind going over maybe some of those things in therapy we look at doing to kind of help people? Like, what does a course of therapy look like for somebody that comes in with carpal tunnel?
Yeah, no, there's quite a few things we can do. One of the things that I'll do with a lot of my carpal tunnel patients is what's called the nerve glide. And what we're doing there is if we take the nerve that starts here in the neck, goes all the way into your fingertips, if we can take it, so if this is your neck and this is your hand and where the nerve ends, we can kind of slide that nerve through the anatomical container. And it's going to look something specifically for that median nerve. If you get it on here, that nerve is on slack. That means there's a lot of play, a lot of wiggle room. And then if we bring the arm and the hand out like this, that's where it's going to get a little bit of a stretch. But that's a good thing because these nerves, they need three things in order to be happy, and that's movement, space, and blood flow. So if we're moving it throughout the container, that creates more space, reduces some of the irritation and any possible swelling. And when you do that, that gives more room for the blood flow to come in and calm down this angry nerve. We can also get hands-on, do a few different massage techniques, try to mobilize the carpal bones and some of the muscles throughout the forearm and the hand. And once we got it calmed down a little bit, we want to start looking at some more functional things. So, like, what are the activities throughout your day-to-day that kind of bring on some of these symptoms? What are some exercises we can do to build up the resilience of your hand and forearm muscles and make sure that we can get back to doing the things that we want to do. And that's going to be pretty individual based upon the person. Somebody that's like an electrician or somebody that's working with their hands outside doing activities like that, the exercises are probably going to look different for them compared to somebody that is experiencing all their symptoms if they're just typing for prolonged periods. So, yeah, that's kind of how that treatment would look.
Yeah, it's like I said, a very typically a treatable condition for most people. There's other options to splinting and things we can always talk about with our patients. Ergonomics, review of what people are doing and how they're irritating it. Like you said, we got to calm it down first, and then strengthen up the area and improve their resiliency because they want to get back to doing all those things they like to do. Um, but I will say that like when is the time to get some further testing, or maybe it's not working. Good news with carpal tunnel too is surgery is a pretty good option as well if it's really stubborn. Um, so for me, when patients come in, and if hopefully most of them are getting better, but if they're not, we can do some other things, send you on for further testing, EMGs, which is where they check nerve conduction. And then from there, you can do steroid injections and surgery as well. So there's other options as well, but therapy is a good place to start. So for me, just a quick recap then, Nick, it's, carpal tunnel is kind of some irritation along the median nerve through here. Really presents as numbness, tingling, and pain in the hand, maybe some clumsiness. Um, we can definitely help in therapy by calming down, increasing some space in that carpal tunnel with some of our manual techniques, get that nerve calmed down with some gliders, and then strengthen up the area with some functional tasks. Uh, Anything you want to add?
No, I would say that therapy is a great place to start, especially if we're looking at cost efficiency wise. Uh, with surgery, injection stuff, and that can be a great road to go down. But I think it's physical therapy is always a good place to start because the outcomes and the research, all they look pretty good for the stuff that we can do here. And in the long run, I think it'll save you some time and possibly money for a lot of people. So
Right.
it's a good option.
And if you're going to have surgery, you're probably going to have therapy afterwards, anyways, right?
Yeah, right. It's
So,
you'll likely find yourself in the clinic somewhere
yeah.
with
Uh, so
this.
yeah, that's a wrap for today. Thanks for listening. If you found this video helpful, give us a like, subscribe for more physical therapy videos in the future, and leave comments. Any questions, check us out on Facebook, Big Stone Therapies Fargo. Give us a call at 701-478-7868 if you're interested in scheduling up a visit. See if it is carpal tunnel and what we can do for you. Thanks for watching. We'll see you in the next video.